Olá, sejam todos bem-vindos. Hoje temos nos nossos estúdios o médico Oscar Karbi, que atende nos serviços de emergência do William Osler Health System. Com licenciatura na Universidade de Toronto, o Dr. Karbi está a divulgar 5 dicas importantes para a prevenção de doenças respiratórias, que geralmente ocorrem nesta altura do ano. First of all, we would like to thank you for accepting the invitation for this interview.
Thank you for having me, Helena.
So, your efforts in battling respiratory diseases are based on 5 preventative tips, right?
Yes.
Let's start with one that, due to increased misinformation on the internet, is facing great resistance from some people: vaccination. Why is it so important for people to get vaccinated?
Well, it's very important to be vaccinated against the primary winter respiratory viruses because that's the main way to prevent infection in the first place. There's other things, as we will discuss, but vaccination is key in preventing infection in the first place. Currently, we're right in the peak of the winter respiratory virus season. It goes from December to February, and we're smack in the middle of it right now. So RSV, COVID, and influenza are really rampant in the community.
The second tip, hopefully far less controversial: always wash your hands, right?
Yes. It's not always practical to wash your hands, but people are encouraged to use hand sanitizer, and I always carry a small portable hand sanitizer in all my coats so that it's very easy to disinfect my own hands if I touch a door handle or some other fixture, because that's one of the ways you can catch viruses.
We now return to a measure that has proven very effective, but which unfortunately, also due to misinformation, is rejected by some people: the use of a face mask. How does this measure reduce the spread of diseases?
Well, a well-fitted mask reduces the transmission of viruses from person to person, and in fact, we strongly recommend that people do wear a well-fitted, proper surgical mask when they are indoors with people other than their own family or in public spaces. And when they do come to visit our hospitals in particular, we require that people wear the masks that we provide in all patient-facing areas when they come to visit loved ones, that they not visit them if they're sick themselves. And in fact, they should wear a mask in all areas of our hospitals. We have 3 sites, and in all the areas at all entrances, masks are easily available, and we encourage people to wear while they're visiting our facilities.
Another relatively simple method that goes along with washing hands is fresh air. What is the effect of fresh air indoors?
Well, fresh air indoors reduces the number of viral particles in the air. And because it's winter, we spend more time indoors as a society than outdoors. And if you don't change the air or ventilate the air very effectively, then the viral particles are more numerous. So if you can, please ventilate your households, turn on the fan of your thermostat, or if the weather permits, open the window once in a while to ventilate the home.
Last but not least, if you are sick, stay at home, right?
Yes.
If everyone did this, we would have fewer health problems. Do you agree?
Definitely, definitely. When you're ill yourself, please don't go to work or come visit loved ones at the hospital. That's how viruses get transmitted.
Dr. Karbi, thank you very much for joining us today and for sharing these very important tips. And now, if there's anything else you would like to share with the Portuguese Canadian, please.
No, just thank you for having me, and thank you for inviting me, and it was a pleasure to talk to you, Helena.
It was a pleasure for us to talk to you, Doctor. Thank you so much.
Thank you. Thank you.